Dr. Stella, I can see you already. Please step on and share your 10 minutes. Please keep it to 10 minutes because we know we've held people down and we still have so much to give for the rest of today. Dr. Stella, over to you, please.
Hi.
Hi.
Good afternoon. Permit me to stand on existing protocol. It's an honor to be among very powerful women, my elders and my colleagues, and to be here with our senator, who I'm very, very proud of, and our former minister, Professor Pat Naji, and other important dignitaries today. Good afternoon. I'm Dr. Stella Iwuagwu. I'm talking today, I've been asked to speak about food security, the role of women in food security. Well, I am a nurse, I'm a midwife with a PhD in health education. How did I get involved in food security? For over 25 years, on graduating from the university, I have been involved in health as a human right. I've been involved in patient rights. How do we improve the rights of patients? Interestingly, I got into an accident in 2007 and fractured my back and became paraplegic. The health system that I've been trying to improve almost swallowed me because I was severely mismanaged at the National Hospital. I was eventually flown to Ghana and from there back to the US. But you see, on coming back in 2015, I lost my younger sister through the same health system. They left pieces of placenta in her womb and she eventually died. A few months after, I lost my father. I came home from America where I was teaching as a professor. I came back to Nigeria, determined to focus on the health system. What can we do to improve the right to health? What can we do to ensure that people are properly taken care of when they are ill within our health systems? I did these documentaries, did all the work I did, but over time, I reassessed my priorities. I realized that we cannot, I had to change my theory of change, that we cannot accomplish the right to health, nor any of other rights, without accomplishing the right to healthy food and healthy environment. And it's on this premise that I started thinking, what can we do to improve access to healthy food? At the time, and still now, even the food we're buying from the market, a lot of women are at the center of producing it. A lot of this food are grown with a lot of chemicals, a lot of fertilizers, a lot of pesticides, a lot of herbicides, with little or no education or training on how these are used. So when our people don't eat well, so you see, one, we have very high level of malnutrition. When we don't eat well, our immune system is depleted and we fall ill very easily. We have women who are suffering from anemia. When a woman doesn't have enough blood, no amount of miracle will save her from dying from that childbirth, especially with our blood donation system that is not enough. So you see a lot of women dying from anemia and bleedings within our health system, when they try to deliver their babies. So I started making the connections. And then climate change, so that is looking at it from a health perspective, the connection between food and health. Then you now look at the connection between food, health, and climate change, our environment. Men need oxygen, plant needs carbon dioxide. So when we do not have enough plants within our system, we do not have enough oxygen. So for us to have balance, it's important that we are growing enough trees and plants to supply us with the oxygen that we need and to absorb the carbon dioxide, which is contributing to climate change. We see our environment every day. You hear about flood, you hear about instability in the weather, and we cannot have food security when we have a system where farmers are not confident about the weather. They're not confident that their farm structure will not be eradicated. They're not confident that what they plant will grow well. So you see the connection between the environment and the food we eat and our health. Now you can also make the connection. We'll be talking about wealth creation. 2/3 of smallholder farmers in this country are women, and most of them are in the rural area. And there is a lot of changes in how they are farming. You know, when I was growing up, my mother, even though she was a trader, she farmed. Every vacation, she took all of us, her children, home. She had 8 children. We never lacked food because we always grew our food. In Igbo, every woman has a backyard garden. When you come home from the city, our grandma will run to her backyard and proudly hustle up a healthy meal just from the things in her backyard. Now, many of us have left the village and we're in the city and we're depending on food that is growing in the village. Who is growing those food? All the elderly women and men in the community that are exhausted and tired. They can barely find anybody to even till the land for them. So you wonder, how are we going to have food security? Part of the challenge of our food security situation today, even those that are farming are not confident that they'll be able to harvest what they have farmed. We have the headers incidents. We have the insecurity that we're having even in the east and other parts of the country. Even those that are growing food are not confident that they can go to their farms safely. So the insecurity situation is contributing to our food insecurity. So if we can't go to the big farms to farm, and if we are not sure that the food we are eating, that they're not grown with chemicals that end up hurting us. You've all seen the WhatsApp, the things flying on social media and WhatsApp, where you see people spraying food with chemical, dipping food in chemical to ripen them, putting food even in gutters and places that make it so insecure for us to eat. So the food we are eating is killing us. What I'm doing is giving you the background on how did this nurse midwife end up becoming a farmer. I realized that if we are not eating well, if our food is hurting us, if we're not getting the micronutrients we need, if we're not getting the antioxidants we need, we are not going to be healthy. And the health system will continue to be overwhelmed by very ill people. As women, and of course men too, we're charged with the health of our families. If as women, sometimes we want to deal with the politics, we want to be visible and viable, but we also want to be healthy. We want to raise healthy families. We want to raise healthy children. We want to raise a healthy nation. It is important that we are informed about how the food we eat impact on these goals. Because they said an apple a day keeps the doctor away, right? How many of us are eating those apples? And the apple does not necessarily need to be the American or the Western apple. It just simply means fruits and vegetables. What is growing in our backyard? It's easy to say eat fruits and vegetables. What you're buying, of what value is it? Is it safe? Even when you buy, by the time you bring it home in a day or two, it has deteriorated, it has rotted down. But if we grow this in our backyards, our likelihood to eat this food will be higher. So I ask you again, what is growing in your backyard? Our forefathers, our grandparents, they took pride in planting economic trees in our backyards. When we go to the village, we enjoy fruits and vegetables that are nourishing. But now, that is not the norm. Now we're actually taking fruits from city back to the villages because we are now busy planting exotic plants, the royal palms, the masquerade trees, and all the fancies without focusing energy on what will nourish us. If we want to focus on women, we also ensure that our women population are healthy and they're also economically viable. My grandmother used to tell me when I get wasteful, Stella, be careful. money doesn't grow on trees. But now I've come to learn that money do indeed grow on trees. So if we're looking at economic empowerment of women and men and young girls, here at SD Farms, one of the things I did was start a farm called Sustainable Demonstration Farm. Here we're teaching people how they can create wealth through agriculture, how they can create wealth through even what they grow in their backyard. If we deal with permaculture, which is what this backyard farming that I'm proposing, encouraging means, it means people can grow their food and eat healthy from their environment. And if we teach our children, if we teach our young people, if we teach our boys and girls and men to grow food in their backyard, then we are on our way to economic independence. One of the things we have done is looking at not just growing the food, but how are we packaging and processing this food? An example of what we have done is put food in processed forms. For example, how many of you know that there are plants, things you can plant and use them for medicine, which we call mediscape? Planting what you can use as medicine. Scent leaf, for example, is a plant that we call nchuanwu, right?
I'm coming up again. You would. We are totally enjoying this, but I'm coming up again just to remind us that we need to wrap up in 1 minute. Thank you very much.
Really? Already time flies that fast. Anyway,
time flies when you're having fun. We're enjoying it, but 1 minute.
The point is, we must be able to look into the issue of agriculture and food security and the role women play. We should start from our backyards. We should encourage our women, even as we are getting into politics or as our politicians are trying to emphasize, don't just give them bags of rice. One time I wrote a proposal to one of our senators. We can actually get the women to plant palm trees around their farms, plant economic trees around their farm, and then invest in processing. And when we process and we export, we are able to attract more money for the food that we grow than just planting to eat. And then when we don't process them, they perish and we have a lot of post-harvest loss. So my take and contribution to the conversation is, as we're looking at empowering women, as we're looking at bringing them more people into politics and creating wealth, it's important we look into backyard gardening. It's important we look into food security. It's important we look into vertical gardening. It's important we look into other ways within the economic sector that women can be empowered to be processors, to be aggregators, to be exporters of the crop they grow. Thank you very much.
Wow, thank you so very much.